Claudia Webbe.
Thank you, Mr Deputy Speaker. Announced today, Leicester will move into Tier 4, the city that has been in lockdown longer than most. In Leicester, we have not been allowed to meet inside any household since the start of the first UK lockdown. That's 10 months, Mr Deputy Speaker. The Home Secretary was dangerously wrong to claim that the government have been ahead of the curve throughout the pandemic. There can be zero doubt that on every major strategy the government got this wrong. The government have lost control of the virus. Today, 50,023 new COVID cases and 981 deaths. On August the 1st, Mr Deputy Speaker, deaths from coronavirus had fallen to almost zero. We were at a crossroads. The government should have opted for a zero COVID strategy. Germany, for example, invested 500 million in making schools ventilation proof. China brought plexi screens into classes. Italy carried out randomised testings of pupils. In England, with no disrespect to teachers and our excellent teaching unions and head teachers, we put some sticky yellow tape on the floor claiming that mere distancing in the classroom would be sufficient to scare off the virus. The Prime Minister visited a school in the county of Leicestershire and proclaimed that we were safe, that students' classrooms were safe. Within days of his visit, a positive infection had been confirmed. The government had a choice. Its own SAGE experts told them that opening schools would push the R rate above 1. Indeed, this week, SAGE explicitly told the government to close schools, and yet in the first wave alone, 148 education staff died of coronavirus, according to the Office for National Statistics. In the second wave, deaths of teachers have continued to mount. History will judge us harshly for ignoring teaching professionals and scientists when they warned us to close schools. The government acted the way it did because it perceived itself to be putting wealth before health. It didn't matter to them that African, Asian and minority ethnic people or the poor were more than twice as likely to die from coronavirus. As long as the City of London kept trading, they thought it was a price worth paying. What the government have failed to grasp is that health is wealth. It was a false choice. By pursuing a zero COVID approach, they could have crushed this R rate right down and brought time to implement a proper randomised testing system. They could have invested in online learning and proper equipment, including the internet, so that students could study from home. Most of all, they should have trusted NHS professionals to run the test and trace system. By handing 12 billion of coronavirus contracts to people linked to the Tory party, they put donors first. Public health and NHS local bodies were ideally placed to conduct test and trace, and the government failed to include them. There is still time to save many thousands of lives. Go further than the tiers approach, which at best gives rise to divide and rule. Implement a zero COVID approach, a national lockdown. Yes, close schools, keep them closed. Listen to the science. Give people the full financial support to stay safe, including the 3 million excluded. We are only as safe as the most vulnerable amongst us. Give status now to all undocumented workers. The vaccination approval recently announced is inspiring news for all. Where politicians have failed, scientists have stepped up. The government must now ensure that those most at risk get the vaccine first. This obviously means care home residents and NHS staff, but it should also include the minimum wage workers who get us through this pandemic. A Deliveroo rider has more right to the vaccine than the Etonian billionaires. We must also make sure that African and Asian and minority ethnic communities and the poor are given fair access to this vaccine. We know the elderly are most at risk from this virus, but yet still more that 70,000 Indian and Pakistani grandparents live with school-aged children. The government would have been willing to place these communities at risk by reopening schools. I implore the government to change direction before many other thousands of lives are lost. One last thing, Mr. Deputy Speaker.
No, the time limit is the time limit. Thank you very much.